Thank you for joining us today at our virtual reality naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched this simulation back in February 2020 at CADCA's National Leadership Forum. We then engaged with many of our amazing coalitions to learn how our communities can host events using this technology. We had amazing initial feedback, including how to use this VR tool as a standalone awareness event, how to create a training around it, or add it to trainings that are already being held. Just as we are starting to host in-person community awareness events using the technology, we all know what happened and we moved to virtual everything. And while we are hoping early next year allows us to have more opportunity to host events and be together in person, we're currently hosting virtually, and we're thankful to our amazing CADCA members, and specifically today, thankful to our good friends and tonight's co-hosts, Dr. Grenade Dudley at the Love Detroit Prevention Coalition, Adora Izika at the Detroit Department of Health, and Jeff Griffith from the Youth Connection. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for tonight. First, we'll hear from a wonderful group of speakers here in Michigan who are working every day to save lives. We are honored for them to be part of this event today. Then, along with the Walmart Academy team led by Colton Drish, we will view a virtual reality simulation that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. We'll follow along with the Academy lead who will be experiencing this training in a VR setting while wearing the Oculus headset. Lastly, we would love your valuable input while learning from you all in attendance here, how you would use this virtual reality format in your communities. From these events, we plan to learn how to roll out this technology nationally and what resources we need to accomplish that. So again, we'd love your input. After we hear from our speakers and see the simulation, we'll have a few minutes for some guided Q&A. I'll ask a few questions at the end of the hour, and if you can type your answers into the chat, we appreciate your input. Additionally, in the weeks to come, we'll reach out to you all as a group to get more input from you as well. And now on to our speakers. First, we'll start with CADCA's president and CEO and my boss, General Barry L. Price. After a decorated and distinguished 31-year career in the United States Army, General Price joined us at CADCA nearly 5 years ago as our Executive Vice President and Chief Operating Officer. Last September 1st, he was named CADCA's third ever President and CEO, and we are excited to have him as our leader. General Price is a recipient of numerous military awards and decorations, including the Distinguished Service Medal, Defense Superior Service Medal, and the Bronze Star Medal. His impact on our nation's armed forces is felt to this day. General Price, thank you for your service to our nation and now to your service to our communities, and I turn it over to you.
Thank you, Reiko, for that introduction. My mother absolutely loves you and the introductions that you do of me. So thank you again. Let me start off by saying that our co-host today, Dr. Dudley, and the Love Detroit Prevention Coalition have been great advocates and allies of CADCA for many years, and they are truly making an indelible impact on Detroit. So thank you for your tremendous work, Dr. Dudley. CADCA is excited to join Dr. Dudley, Dr. Janae Khaldun, Denise Fair, and many community leaders who have lent their voices to this game-changing virtual training that we will premiere in about 15 minutes. We're honored to be here with other leaders from the state of Michigan for this training and virtual demonstration on how to save a life by reversing an opioid overdose. I would like to personally thank Walmart for their investment in not only this technology, but for their investment in the people who will benefit from this life-saving training. And a special thank you to everyone on today's training. We hope that this unique event will train you on how state and local agencies are collaborating to combat the opioid epidemic in our communities. CATCA has a footprint in over 30 countries worldwide, more than 5,000 across the United States, and nearly 100 coalitions in the state of Michigan. We have sought to train residents and leaders to build and develop coalitions in their communities and reduce substance use through the adaptation of CATCA's model for community change. We know that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. And prevention has become more important now than ever. Recently, the CDC reported that 93,331 drug overdose deaths occurred in the United States in 2020, the largest number for a 12-month period ever recorded. That number would be one of every 8 people in the city of Detroit. It would fill Ford Field Stadium nearly 1.5 times over. This is tragic, but not surprising news. As more and more Americans are getting vaccinated and life is returning to normal, many have lingering and heightened stress as well as anxiety related to physical and social distancing. I want to take a minute to talk to you about our motto, One CATCA. One CATCA is a call to action. It signals to the participants that that we must unite in this movement and come together as one if we are to win. One team, one vision, one CATCA. Together we are stronger as we train substance use and misuse prevention to coalitions every day of the year, all across the world. We know that without the buy-in of leaders and community stakeholders such as yourselves, our desired end state will prove unachievable. As CATCA's president and CEO, I wish each of you success in your direct communities and ask you to join me in becoming One CATCA. I cannot do this without you. You are all true heroes in your community. I'm excited to be a part of this event today and our partner Walmart, who has developed a virtual reality tool to deliver a powerful experiential element to naloxone overdose reversal trainings. It's never been more important to know how to save a life, and our coalitions are at the forefront of efforts in their communities and are making a tremendous impact. I will now pass it back to Rico. Thanks again for joining us today.
Thank you, General Price. It was great to hear from you, and we always appreciate your time. Now it is my pleasure to introduce Dr. Jonah K. Khaldun. Dr. Khaldun is the Chief Medical Executive for the state of Michigan and Chief Deputy Director for Health in the Michigan Department of Health and Human Services. She provides overall medical guidance for the state of Michigan as a cabinet member of the governor and oversees public health and aging programs, Medicaid, and behavioral health. In 2021, she was also named by President Biden to the COVID-19 Health Equity Task Force. And now we'll hear from Dr. Khaldun.
Hello, my name is Dr. Jonah Khaldun, and I'm the Chief Medical Executive and Chief Deputy Director for Health in the Michigan Department of Health and Human Services, and I'm honored to chair the Michigan Opioids Task Force. Thank you for the opportunity to participate in this virtual event hosted in partnership with the Community Anti-Drug Coalitions of America and Walmart. I'm excited for this new partnership and know that these efforts will increase awareness around the opioid epidemic and the life-saving efforts taking place across the entire state of Michigan. In 2000, 183 Michiganders died of opioid overdoses. By 2019, that number rose to more than 2,000, a rate more than 9 times higher. That's a rate of over 5 people every single day. And after a decade of steady increases, we know the COVID-19 pandemic increased overdose deaths in general. Preliminary data shows a 14% increase in overdose deaths from 2019 to 2020. Our data also shows the disproportionate impact the opioid crisis is having on communities of color. Data in Michigan shows the prevalence of opioid use disorder disproportionately higher among African Americans during the pandemic. Throughout the pandemic, African American men died of an overdose at a rate over 1.5 times higher than their white counterparts. In May of 2020, one of the third highest months for COVID-19 deaths in Michigan to date, African American men were more than 70% more likely to die from an overdose compared to their white counterparts. However, this crisis is more than about percentages. Behind those numbers are people and their loved ones, our neighbors, our family members, and our friends. We certainly understand the personal toll of this crisis, and that is why our forward momentum and continued dedication are crucial. Michigan is committed to our strategy to reduce overdose fatalities by half by the year 2025. And that includes access to naloxone, an opioid overdose reversal drug that saves lives every single day. We want everyone who is at the highest risk of witnessing or suffering an overdose to have access to naloxone. Michigan has made great strides in removing barriers to access to naloxone at the individual and organizational level. In 2016, legislation was passed to allow a naloxone standing order, which has been a great success with 58% of pharmacies participating and over 20,000 doses of naloxone dispensed since its launch across the entire state. MDHHS also has a naloxone portal that allows organizations to order naloxone free of charge. And since the portal's launch in January of 2020, over 150,000 naloxone kits have been distributed. Individuals may also order naloxone through a partnership with Next Distro. Despite this progress, in 2020, a study found that around 25% of individuals using opioids in Southeast Michigan had access to naloxone. Recently, bipartisan legislation was introduced to expand the naloxone standing order and give community-based organizations the ability to directly purchase and distribute naloxone. And we look forward to working with Governor Whitmer and legislators on this very important package. With these efforts, Michigan will continue to make progress increasing access to treatment and naloxone in order to save more lives. Information about naloxone and opioids-related work can be found at michigan.gov/opioids. Thank you for the opportunity to share about the work of MDHHS and the Michigan Opioids Task Force, and I truly appreciate the dedication and work of our partners like you across the state.
Thank you, Dr. Khaldun, for taking the time to be part of this event, and thank you for everything you do every day for the state of Michigan. Now we turn to hear from Denise Fair. Denise Fair serves as the Chief Public Health Officer for the Detroit Health Department, appointed by Mayor Mike Duggan. In this role, she directs public health strategies towards protecting the health and well-being of residents, including vulnerable populations like seniors and Detroit's people without homes. Denise leads a team of more than 250 public health experts who also support the economic viability of the city by offering public health guidance for the safe operation of businesses, churches, and educational institutions. I'll turn it over to you, Denise.
I'm Denise Fair, Chief Public Health Officer for the City of Detroit. The Detroit Health Department has more than 40 programs to improve the lives of all Detroiters by providing the support and resources they need to be on a path to total wellness and thrive, including our 313 HOPE program that provides education, training, and connects Detroiters in need with mental health, community, and recovery support services. Through the community partnerships, the Detroit Health Department's 313 HOPE program is able to provide Detroiters with a path to life free from addiction through services that are both accessible and equitable. Some of these programs are trauma-informed training, screening and counseling, case management, crisis response, and data and surveillance. The COVID-19 pandemic led to a sharp increase in overdoses and fatalities as Detroiters battled increased levels of isolation, depression, stress, and anxiety. The City of Detroit responded we worked with partners to expand access to Narcan, a life-saving medication that reverses opioid overdoses and literally saves lives. The Love Detroit Prevention Coalition provides training in the use of Narcan to all of our Detroit police officers. Training is completed at all precincts and ongoing at the academy for all cadets. Now that training is being expanded through the coalition's partnership with the Detroit Health Department and DWIN, providing in-person and also virtual training to the entire community, including business owners, youth, and also community health workers. And now the training is available to anyone who wants to learn how to respond to an overdose. The health department has now trained over 4,000 community members and frontline professionals. The health department has also distributed more than 8,000 doses of Narcan, along with information about resources to ensure that any organization or coalition or individual is equipped to respond to an overdose emergency or refer a person to wraparound services. We have now distributed over 6,500 education resources, including outreach to over 200 medical professionals on alternatives to prescribing opioids for acute pain management. As your health officer, I would like to see everyone trained to administer naloxone and for every facility to have Narcan. We follow data, and current data from System Opioid Overdose shows that deaths and overdoses are disproportionately high among African American men in Detroit. This is unacceptable. And that's why I'm encouraging everyone to support the Love Detroit Prevention Coalition campaign to train 1,000 Black men to use Narcan by the end of this year. Thank you, Corporation and Community Anti-Drug Coalitions of America, General Price, and Walmart Corporation for promoting Narcan training throughout the state of Michigan. There is no doubt in my mind that many lives will continue to be saved through this life-saving medication that's fast-acting and easy to administer in a crisis where every second matters. I want to acknowledge the work that is being done by Love Detroit Prevention Coalition, the Youth Connection, and the Detroit Health Department's 313 HOPE program and DWIN for coordinating efforts to help people who really need someone to speak on their behalf. In closing, I want everyone, keep up the good work. Let's stop this pandemic so we can keep people safe and give them the first step to getting on the path to recovery and good health. Stay well and stay safe.
Thank you for those remarks, Denise, and for talking to us today and really helping us better understand some of the really impactful work you are all doing in Detroit and your support of local coalitions across the city. I'd like to turn it now over to the chairperson of Love Detroit Prevention Coalition, Dr. Grenade Dudley. Dr. Dudley is a leading advocate of children's welfare and is the president and chief executive officer of the Youth Connection, whose goal is to connect youth to brighter futures. She also serves as a master trainer for the City of Detroit Health Department Behavioral Health Division. Dr. Dudley is a licensed clinical psychologist and has designed, developed, and implemented nationally recognized programs that address substance use prevention and the needs of children and their families. As chair of the Love Detroit Prevention Coalition, she is the proud recipient of CADCA's 2019 Chairman's Award, and I am proud to call her my friend. Dr. Dudley.
My name is Dr. Grenade Dudley, and I serve as the chair of the Love Detroit Prevention Coalition and the president and CEO of the Youth Connection. Our leaders and experts have shared with you the devastating impact the opioid epidemic has taken on colleagues, friends, and family. The consequences of misuse have left children without parents and parents without children. Being a partner in your own healthcare encourages you to ask questions regarding an opioid prescription. What? How much? How long? What happens if? Having naloxone, the life-saving medication on hand to prevent opioid, heroin, and fentanyl overdoses that could lead to death, is not only the smart decision, but the right decision. The Love Detroit Prevention Coalition and the Youth Connection is actively engaged with our health department's Behavioral Health Division 313 Hope Detroit and the Detroit Wayne Integrated Health Network to train and distribute naloxone to anyone in the Detroit and Wayne County who will join us on a Zoom or arrange to have an in-person training. We have provided training to every Detroit Police Precinct, the Police Academy, the Transit Authority, youth, parents, university students, nurses and pharmacists, Wayne State University Kappa Alpha Psi fraternity, veterans, churches, active users, frankly, to anyone who makes a request. We are part of a network of drug-free community coalitions across Michigan that work actively and tirelessly to address drug use in our targeted communities. For those coalitions that are addressing opioids and the non-medical use of prescription drugs, we are excited that community access to naloxone will be part of Michigan's standing order. We are thankful to CATCA's dedication in providing resources and training for us to make a difference and the opportunity for continuous quality improvement. We sincerely appreciate Walmart's focus and engagement in the effort to address the opioid epidemic and helping to support healthy communities throughout Michigan. I think, I'm a pretty good cook, so I want to share a recipe on how to cook a community. It's quite simple. You take a community, any community, whether it's in Escanaba, the Keweenaw Peninsula, Alabaster Township, Mackinac, Kalamazoo, Grosse Pointe, Detroit, or Saginaw. Any community whatsoever. Now get one of those large cauldron witches use at Halloween. Add a little bit of water so your community won't stick. Stir in a half a quart of We Are Not Responsible. Mix in 2 tablespoons of I Didn't Know It Was That Bad. Drop in just a quarter teaspoon of Not Being a Partner in Your Own Health Care. Toss in a cup of Limited Resources. Add just a pinch of Stigma. Whisk in the belief that failure is final. Fold in limited or no access to life-saving resources. Beat in an ounce of not addressing diversity and cultural concerns. Drop in a pound of It's Not My Job. Nothing else needs to be done. This community has already been cooked. Because you have tuned into our webinar, your job, should you decide to accept it, is to stay engaged, use data to inform your services, train to save lives with naloxone so that we never, ever cook another community. We're in this together, Michigan.
Thank you, Dr. Dudley. We are in this together. We thank you for all of the work that you do and your friendship with us at CATCA, and just look forward to continuing all of the amazing initiatives and work that we do together. Finally, we have a special message to share with you all. When we asked Love Detroit who we thought would have a powerful story to tell about opioid misuse and naloxone training, they had a harder time thinking of who wouldn't be interested in being part of this initiative, because the issue truly does affect all of us. On that note, Love Detroit put together a brief video of a few more of their amazing coalition's partners. Some of the speakers you'll hear from in just a moment include Colonel Joseph Gasper, the Director of the Michigan State Police, State Director of Emergency Management, and Michigan's Homeland Security Director. You'll also hear from Jason Goldstick, Associate Professor in the Department of Emergency Medicine at the University of Michigan, whose work at the Injury Center involves substance misuse and violence. And we'll hear from Craig Summers, the Executive Director of the Michigan High Intensity Drug Trafficking Areas, or HIDA, program. He serves on both the HIDA and National Marijuana Initiative and Performance Management Process Committees. I'm so excited for us all to see this powerful montage on the importance of naloxone training, and here it is.
The numbers of opioid overdoses and deaths in Michigan and Wayne County are staggering. Access to life-saving medication makes all the difference. Alternatives to opioids, which include medications like Advil, ibuprofen, and Motrin, or acetaminophen like Tylenol, and options that don't include pills such as physical therapy, acupuncture, and meditation, utilizing ice and heat and elevation, and practicing mindfulness and yoga are all effective alternatives to opioids for pain relief.
I'm Karra Thomas with Detroit Wayne Integrated Health Network. I'm your Substance Use Disorder Prevention Manager. I also am the coordinator of naloxone and our faith-based initiative. I'm here today to tell you a little bit about my experience with naloxone. I had a chance to use it on one of our members at my church. We were leaving church to go to eat and dine as we've done every Sunday after service. Of course, this is during the pre-COVID periods as well. And we were sitting and talking and just getting ready to wait to be seated. We were laughing, having a great conversation, and all of a sudden, the signs of what we've been seeing that it relates to a person that may be overdosed with opioids began to show. As I saw these things happening before my eyes, so quickly ran to my car. I keep my kid in the trunk. The goal ultimately was to make sure we safely helped one another in making sure that the person was still here with us, which I am so grateful to say that they are still here with us and are doing much better even health-wise, as I want to make sure that for you in our communities, that you know that this is a safe item. We know from 5-year-olds and up that we want to save those lives to make sure that this is safely an item for us to prevent and not cause any more of our overdoses in our communities.
My name is Nashabia Hawkins. I work for Detroit Recovery Project as a peer recovery coach. I believe that Narcan is a great access tool for regular individuals who may not have their training or who may not be aware of the resources that is available for them. I have advocated for my community and people outside of my community, but just so happen people in my community are opioid users, and I think they need the knowledge. I had someone come knock to my door. I had to administer Narcan to someone I knew over 40 years, and looked up to and called him. But nevertheless, the drug paraphernalia and the opioids and whatever it may, I had to use 2 Narcan doses, which is administered through nasal, and they came to the training. I passed out the information. They came to my job. Maybe 6 people in the neighborhood came and got the training on how to administer Narcan. And we've been moving forward, but this needs to be accessible for everyone in my community so that we can save lives and hopefully get them into recovery.
Hello, I'm Craig Summers, the Executive Director of the Michigan High Intensity Drug Trafficking Area, HIDA. The HIDA program's overdose response strategy is an unprecedented and unique collaboration between public health and public safety, created to help local communities reduce drug overdoses and save lives by sharing timely data, pertinent intelligence, and innovative strategies. The ORS is implemented by state teams made up of a drug intelligence officer and public health analysts who work together on drug overdose issues within and across sectors and states. The mission of the overdose response strategy is to help communities reduce fatal and non-fatal drug overdoses by connecting public health and public safety agencies, sharing information, and supporting evidence-based interventions. The Michigan HIDA partners with the Centers for Disease Control and Prevention, the University of Michigan Injury Prevention Center, the Michigan Department of Health and Human Services, drug-free community coalitions, and other public health partners. Through our partnership with the University of Michigan Injury Prevention Center, the System for Opioid Overdose Surveillance, SOS, was developed to provide near real-time surveillance and data analytics regarding both fatal and non-fatal opioid overdoses incidents that can be used to guide resource allocation for rapid response and prevention.
Hi, I'm Jason Goldstick, and I direct the System for Opioid Overdose Surveillance, or SOS, as part of the CDC-funded University of Michigan Injury Prevention Center Outreach Corps. The SOS team works to provide near real-time suspected overdose data to a variety of stakeholders, including law enforcement, public health, treatment providers, and community outreach organizations. We currently procure and disseminate statewide EMS data and suspected overdoses from medical examiners covering about 80% of the state's population. Through our web-based dashboard, over 400 registered stakeholders across 82 counties have access to spatiotemporally granular data on suspected overdoses in Michigan. That data allows them to determine where to focus efforts such as naloxone distribution, quick response teams, mobile harm reduction units, and prevention programs. Our community partnerships have also worked reciprocally. In particular, we have leveraged feedback from partners such as the Michigan HIDA, the Detroit Health Department, and the Love Detroit Prevention Coalition to understand stakeholder needs and optimize dashboard usability. With that feedback, we have recently enhanced the interface to include spike alerts, data overlays such as census data in hospital and pharmacy locations, and customized spatial windows. We hope to continue to expand SOS to further enhance its usability and to increase uptake of data-driven solutions to the opioid crisis in Michigan.
Heroin and opioid addiction present a severe public health concern here in Michigan and across our country. It can destroy and end lives, devastating families and communities. In 2018, more Michiganders died from drug overdoses than car crashes. It's important that we all do what we can to raise awareness and provide support to those in need.
Hello, my name is Judy Davis. I'm the SUD director here at Detroit Wayne Integrated Health Network, and I wanted to share with you some of the things or some of the efforts that we're doing in the community on a daily basis in order to address the opiate epidemic. With our efforts, we have saved over 700 lives and have distributed over 10,000 Narcan kits. The efforts that we are involved in throughout the year is we provide Narcan training all year long. So anyone in the Wayne County community wishing to receive a Narcan training, you can contact us through our website at www.dwihn.org. We also have 2 mobile units that's in our community that's out there daily. There are boots on the ground. They're out there providing Narcan training and Narcan to those individuals who are at high risk. So we're offering 24 hours, 7 days a week, counseling on demand. We have our 800 number. An individual can call it 24 hours a day, 7 days a week in order to receive services. They can call for prevention, treatment, or recovery services. And thank you.
The Drug-Free Communities Program is the nation's leading effort to mobilize communities to prevent and reduce substance misuse among youth by identifying ways to address structural and environmental conditions tied to substance use. There are 30 DFC coalitions in Michigan who locally develop and implement strategies targeting alcohol, marijuana, prescription, and/or illicit drug misuse by engaging multi-sector stakeholders. DFC coalitions have representation from 12 sectors, including youth, parents, business, media, school, youth-serving organizations, law enforcement, faith-based groups, civic groups, healthcare, government agencies, and recovery support service providers. We encourage you to get involved with your local DFC coalition and to find out ways that you can partner with your city or county health department, PIHP, your closest academic institution and DEA, Michigan HIDA, or the Office of Recovery-Oriented Systems of Care so that you can better advocate for resources to drive solutions in your community.
Get rid of unwanted, unused, and expired medication by taking advantage of DEA Take-Back Days in April and October throughout the state of Michigan. Log on to deatakeback.org for more information. If you have opioids in your home, make sure you have naloxone as well, just in case. Join the Love Detroit Prevention Coalition in creating and supporting healthy communities throughout Michigan.
Because you have tuned into our webinar, your job, should you decide to accept it, is to stay engaged, use data to inform your services, train to save lives with naloxone so that we never, ever cook another community. We're in this together, Michigan.
Hello.
Thank you so much to the entire Love Detroit Prevention Coalition for all the work that's gone into building your coalition partnerships, for being willing to share some of that with us here today. Special thanks to Janelle Stallion for sharing his time compiling this video. We really appreciate your time and what an amazing partner you are. And so finally now, I'm going to pass it on to our helpful partner, Colton Drish, and the team here at the Walmart Academy, who will walk us through the virtual reality simulation. The Academy team will wear the headset and allow us all to experience the virtual reality demonstration along with them. Colton?
Thank you, Reiko. It's truly a pleasure. My name is Colton Drish, and I'm the Senior Manager with the Academy Operations Support Team here at Walmart. Over the last few years, Walmart has invested in our associates by creating academies across the country. Academies are dedicated facilities that provide hands-on training for our associates that combine both learnings in the classroom and the sales floor. The academies have also partnered with our communities in various ways to provide continuous learning opportunities. One way of providing this training to our associates and our community partners is through virtual reality. Virtual reality allows us to recreate those situations that are not easily replicated in the classroom or the sales floor. I am now going to turn it over to the Academy team in Owasso, Michigan, who will demonstrate how we leverage virtual reality.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Use the trigger button to select your answer. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency? Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor. This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you so much to the Academy team for helping us today with the demonstration. And thank you so much to Walmart for hosting us, and to all of the speakers here today who have taken time out to be part of this event, and to all of the participants who have joined us today. So we have about 10 minutes left, and we would love to get some feedback from you who are viewing with just some quick Q&A. I'll ask a couple of questions, and we'd love if you please respond by using the chat. Again, we only have about 10 minutes left, and I know we're going to get so much amazing feedback. So please know we're monitoring the chat, and we'll be following up for you with you for separate and continued conversations. If we don't get to you today, we definitely want to hear from you, and we'll be providing more opportunities to learn from you. So I think our first question that we wanted to talk about really was to just ask the group, what are your suggestions for the best way that you as community leaders might use this virtual reality simulation? And we're getting tons of feedback saying that it was, the demonstrations were helpful and this was informative, which is great. And now we have use it in different trainings for staff. Aaron, we've used it constantly in St. Louis. Would love to see this in urgent care centers. That's great. And we will definitely add that to our list of feedback. Spencer, have it at resource tables. I'm assuming you mean at like conferences and exhibits and virtual resource tables, which is a great idea. Okay. So I guess we would say, where are use it with clients for trainings? Thank you. So where are some events or local efforts? And I know it's a little bit different of a question because, you know, we're just sort of easing back into some in-person events. So if you could think in the past, even virtual events or events that we hope to have in the future again, where are events in your local communities where you could use this training and it would help us engage with more people and train more people on naloxone education? And some examples of this that we've gotten in the past of responses to help county and state fairs, health fairs, PTA meetings, church events. Karra has faith-based organizations, events like that. Would love to see this shown to high school students graduating or college orientations. College orientations we've been hearing, and definitely agree with that. Would it be great to have it at DEA drug take-back events or any of the take-back events that we do in our communities, because we do a lot of them on safe disposal, and I think it's really important. College of Pharmacy, public education programs. Spencer says, your community coalition just had a back-to-school summer bash in Dearborn Heights where you had a naloxone demonstration. This would be a big help to that. Thank you for that, Spencer. We're going to follow up with you. Take back events, yep. Great. So let's ask, what training sites or groups need this the most? Who's the most interested in this? And again, some examples. Will or can it run in major stores like Walmart? Great suggestion. Prevention coalitions, parents. We've also heard things like the gaming community, casinos, volunteer fire departments, small businesses, college fraternities, yep, faith organizations, trap houses, restaurants. There is safe food training, I believe, during that. Great suggestion, Aaron. Thank you for that. Senior centers during meals, block clubs, block parties. That's great. So where are the gaps in your communities? Not just where we can educate and train more individuals who need to know about naloxone and who should have it and learn how to use it, but we'd also love to know, are there people in your community who need naloxone but can't access it, or they don't have enough of a supply of it? For example, fire departments or volunteer community health workers, pain management clinics, server training. So really it's, are there areas in your community that just don't have access or don't have enough access? Where are the gaps in that? Send this as alert to social media and to apps. It's a great suggestion. Thank you, Karra. Non-US citizens, low-income workers who can't take off to get it training at normal places, or to pick it up at normal places. Great suggestion. Crisis response teams and peer recovery coaches. Okay. Okay, and we're going to just ask one more, and again, we are taking all of these comments from chat. We really appreciate them. So we are hearing them all, we're recording them all, and we have them all. So if I'm not calling it out, believe me, I see it and we are recording it. So thank you. So we're nearing the end of the hour. I'm going to ask one more question. What are some questions we should be asking to help us create a national rollout of this? And again, I'll give you some examples. It's, we had great ideas and great questions on how do we reach populations where English is their second language? And we need to be thoughtful of that. And how do we include the recovery and treatment audience? And 12-step programs. And there's still a huge stigma problem, definitely. And that is something that we know we have to address. And we have to continue to be talking about that and really have stigma always as a factor in everything that we're doing. Great. Media plays a great part in promoting awareness. Absolutely. Great. So we are now through the hour. We really want to extend our thanks to all of our speakers and participants for attending this event. We truly appreciate your time and insight. Please reach out to us at CADCA anytime with more suggestions and questions. Look for us to be reaching out to you. My name is Reiko Mendoza, and you can reach me at rmendoza@cadca.org at any time, or the amazing team that is part of this initiative. We are going to conclude the evening. We appreciate your time. Have a wonderful rest of the week, and thank you again.